Thanks very much, Sherry. It is great to see so many Melburnians out tonight on a fairly chilly night to talk about something that I guess we all take very much for granted. Within a few kilometres of where we sit tonight, some of the city's best hospitals, certainly our ability to take care of our health with such a fantastic public health system is certainly something I think that many of us take for granted. So it's a really opportune moment to take this opportunity to discuss this issue. And we are joined by four very esteemed panellists to talk through the myriad of issues underscoring that question, health at whose cost. Firstly, each speaker will give us a brief 5-ish minute perspective. Well, I'm not sure I've ever heard Sagas speak for 5 minutes, but we'll see how we go. Then we'll settle into the chairs, have a conversation about some of the issues that are raised, and there will also be an opportunity for you to ask questions of our panellists later on this evening as well, and I certainly welcome and encourage you to do that. Our first speaker is one of Melbourne's most esteemed medical researchers and thinkers. Austrian-born, Australian-raised, Sagas Nossel was the director of the Walter and Eliza Institute of Medical Research for 30 years and was knighted in 1977 for the groundbreaking work in immunology he pioneered there. He was made a Companion of the Order of Australia in 1989, was awarded the Albert Einstein World Science Award of Science in 1990, an award for researchers that, and I quote, brought true benefit and well-being to mankind. He was also the recipient of the Australian of the Year award in the year 2000. He's a former chair of the Global Foundation Advisory Committee, deputy chair of the Council for Aboriginal Reconciliation from 1998 to 2000. Sagas is currently Professor Emeritus within the Department of Pathology at the University of Melbourne. He's also a consultant for the World Health Organisation and the Bill and Melinda Gates Foundation and a principal of Foresight Associates Proprietary Limited. He's also found time to be here tonight. He's a proud and much-loved Melburnian. Please make welcome Sagas Nossel.
Thank you very much indeed, and good evening, my dear fellow panellists. Good evening, ladies and gentlemen. Yes, it is great to see so many of you here for this important forum. I want to start with a quote from the Irish poet, Nobel laureate Seamus Heaney, who said, "Even if the hopes you started out with are dashed, hope has to be maintained." I've been in international health for 40 years now. I've seen many hopes dashed. But I detect that in the last decade, a new breeze is blowing. New and legitimate hopes are stirring, and in the next decade, we might see real progress. Let's look first at why action is so urgently needed in global health. I think nothing that says it more tellingly than when we look at life expectancy and under 5 mortality, two general reflections of overall health. Look at the gap between best and worst. Life expectancy in Japan for males is 81, for females 86. In the worst country, Sierra Leone, less than half. Life expectancy for males, 39 years. Life expectancy for females, 43. And as if that isn't a stark enough reflection of a global inequity that is just intolerable, let's look at deaths under 5 per 1,000 live births, a very widely used measure, surrogate for the health of a community. Sierra Leone, 262. Sweden, 3. Ladies and gentlemen, I don't think I want to live in a world where there's a nearly 100-fold difference in under 5 mortality between best and worst. But you'll say, look, you're talking at the wrong time. The world's just coming off a global financial crisis. We can't afford to do any more for Africa. We can't afford to put any more into health aid. Ladies and gentlemen, the world can do it if it wants to. In fact, the global financial crisis showed just what governments can do when they want to. The US Wall Street bailout, $700 billion. The stimulus packages from the G20 and really over the whole world, total global stimulus packages, $2 trillion. The wars in Iraq and Afghanistan cost one nation, the United States, $150 billion per year. Now, the distinguished health economist Jeffrey Sachs has said that an extra $120 billion per year would make the Millennium Development Goals much more achievable. The world can do it if it wants to. And yes, ladies and gentlemen, health progress is possible. I've mentioned the deaths in children under 5. But guess what? They're coming down. Deaths in children under 5 were 13 million in 1990, 9 million in 2007, estimated 8 million in 2010. Unless you think that that's due to some incredibly sophisticated intervention, most of those 5 million deaths saved are due to simple measures like insecticide-treated bed nets for malaria, measles immunisation, vitamin A supplementation, and oral rehydration for diarrhoea. Of course, 2/3 of the deaths that still remain were preventable. And my other reason for believing that health progress is possible is that over the last decade, some massive new programs have appeared which seem to have, roughly speaking, the right number of noughts behind their dollar figure. At the head are the two major and very similar programs: the Global Fund to Fight AIDS, TB and Malaria, instituted in 2002, and the President's Emergency Plan for AIDS Relief, the US program known as PEPFAR, initiated in 2004. These are providing eminent relief for AIDS and TB and malaria, but mainly for AIDS, to millions of people now. And would you believe, though the toll that it exercises is still terrible, there is no doubt that the peak of the AIDS epidemic has passed. Some other programs are getting traction. I've only got time to mention one or two of them. One I think is of fascinating interest is the control of the horrible worm infections, onchocerciasis or river blindness, and lymphatic filariasis or elephantiasis. These are being treated by community mass administration of drugs like ivermectin twice a year, if you want, deworming the community, putting it bluntly, and that is having quite remarkable success. Now, I'm particularly fond of one program where I've been heavily involved myself, which is called the Global Alliance for Vaccines and Immunisation, or simply Gavi. This was initiated in the year 2000. Through Gavi, 250 million extra children have received the standard childhood vaccines in 72 poorest countries of the world. 233 million children received any or all of hepatitis B, Haemophilus influenza B and yellow fever vaccines, which no one had been receiving before. And the one I think of which I'm the most proud is that measles deaths have been reduced by 74% globally and by 89% in sub-Saharan Africa since year 2000. We estimate that 5.4 million deaths have been prevented in the first decade of this remarkable program. Yet Gavi faces some challenges. 24 million children each year are still not immunised, and there are still 2 million vaccine-preventable deaths each year. And we worry a lot about how we're going to be able to afford to introduce new vaccines that our children are getting, such as the brilliant pneumococcal vaccine, the rotavirus diarrhea vaccine, or Australia's own human papilloma virus vaccine, the anti-cervical cancer vaccine discovered by Ian Fraser. Now to malaria. Well, malaria is a challenge, but the insecticide-impregnated bed nets, at the cost of approximately $5 each, have reduced mortality by at least 50% in those communities that have used them. And although drugs do represent a constraint with the constant threat of resistance developing, drugs can both prevent and cure malaria. And I'm very interested in a program that's a spin-out from the World Health Organization called the Medicines for Malaria Venture, MMV, the Medicines for Malaria Venture. This was a bold attempt to capture the imagination of Big Pharma. And the big pharmaceutical industries have collaborated really wonderfully with MMV. In fact, there are now nearly 50 partners, academic and industry, to MMV. And the companies have made their libraries of prescription drugs available such that 5 million compounds have been screened. And that has brought forward 2 licensed new drugs and 9 other drugs in clinical trial, several with entirely new modes of action. All of that for $55 million a year. Now, you've often heard the statistic that it's cost $1 billion to launch a new drug. Here's an exception to the rule, with some cheap drugs coming forward, and much needed because surely resistance will develop. The Global Malaria Action Plan, which the United Nations embraced on the 25th of December 2008, has as a further linchpin, I mentioned the insecticide-treated bed nets where 700 million are going to be needed, has as an extra arm the question of a vaccine. There is no licensed malaria vaccine, but a wonderful 25-year collaboration between the drug company GlaxoSmithKline and the US Department of Defense, the Walter Reed Army Institute of Medicine, has brought forward a vaccine called RTSS. This is now undergoing its phase 3 trials in 16,000 infants in 10 different sites in 7 countries, hoping for definitive answers and registration by late 2011 or early 2012. The phase 2 trials showed the malaria vaccine to be only 50 to 60% effective. But that is a fantastic start to an area that has been very bleak for many years. Now, ladies and gentlemen, I suppose the real world being the real world, the rollout of these ambitious programs will encounter some setbacks. No one thinks it'll be easy. For that reason, I'd like to end with a quote from Nelson Mandela. "The greatest glory in living lies not in never falling, but in rising every time we fall." Thank you.
It's Paul, isn't it? Thank you very much, Sir Gus. Thanks also to Paul, who's signing for us tonight. We continue our stellar lineup tonight with the Minister for Community Development and Women in Papua New Guinea. Dame Carol Kiddu is widely respected and regarded as a visionary reformer for her work on women's rights and advancement in the Pacific region. She's facilitated major legislative reforms on rape and sexual assault, as well as legislation on child sexual abuse and sexual exploitation, and considerable work and advocacy around issues of poverty, Indigenous rights and people with disability. She was awarded the PNG International Woman of Courage Award by the Secretary of State of the United States in 2007, and named Pacific Person of the Year. The following year, she was the recipient of the Regional Rights Resource Team Pacific Human Rights Award, and in 2009 she received the Cross of Knight in the Order of the Légion d'honneur, the highest award for a non-French citizen. Dame Carol represents Oceania on the FIFA Committee for Fair Play and Social Responsibility, is the Pacific representative on the board of the Commonwealth of Learning, an international advisor on the board of the Cairns Institute, and is a member of the Global Commission on HIV and the Law. She's also a good Queensland girl at heart. Please welcome Dame Carol Kidgeu.
Thank you sincerely. Hanoboi Namuna. We have already acknowledged the traditional owners and the Indigenous owners of this land, and I'd like to acknowledge my mother-in-law, my late mother-in-law, the people of Pari Village, the people of Moresby South, because without them I wouldn't have the privilege of being here today, so I thank them for their support. I'd like to start with a picture in the Highlands area of Papua New Guinea. A Catholic nursing sister, but it could be, she's actually from Germany, but it could be a Papua New Guinean anyone. And she hears this calling from the other ridge. And she hears a man calling. And every now and then during the day she hears this calling. And then later in the afternoon, all day it had taken, she sees this man struggling up the mountain range with a big bilum on his back. The big bilum is the one you carry firewood in. And she recognized the sounds of a woman moaning in labor in that bilum bag. And this man had carried his wife in the bilum bag to try to get help because her birth had not gone normally. She was suffering from obstructed labor. The sister there'd been a lot of tribal fighting in the area. She had trouble trying to find a vehicle. She knew that was beyond her. She realized the uterus had ruptured, and she moved on. She got in a car and got towards the police station to go to Mendi Hospital. The result of the story, after 2 days of struggling for this man to bring his wife to help, was that both the mother and child were lost. And today in Papua New Guinea, between 4 and 5 women will have died in pregnancy or birth-related deaths. About 1,500 women die each year. I'm not a medical professional at all, but I was asked to speak on the issue of maternal mortality. Very important, and maybe child, but I think we haven't got time. I'll stick to maternal mortality. It's a very significant issue in Papua New Guinea at present. We've had a really strong wake-up call. When we got the results of the Demographic Health Survey 2006, and these results came through about 2008, in the 10-year period between 1996 and 2006, the maternal mortality rate in Papua New Guinea had almost doubled, but we are supposed to be tracking towards the Millennium Development Goals. It is true that the 1996 figures were probably under-enumerated, but the fact is our maternal mortality rate had increased. There was no sign of decrease. So it was an absolute wake-up call for Papua New Guinea. We know that we are facing a major challenge in this area. 60% of women in Papua New Guinea give birth with no skilled birth attendant at all. About 35% of women at childbearing age use contraception of some sort. Only 55% of women have 4 or more antenatal visits in pregnancy. And if anything, that's probably a little bit over-enumerated. So there is a very grim picture that we're facing. But we have to respond. The problems are enormous, but there are many positives, and I want to talk a little bit about the positives. Am I speaking too quickly, like I often do? The positives. Because of this wake-up call, and because although, yes, I know you get a lot of negative in Australia about PNG, we do have many very decent politicians, very decent bureaucrats, and yes, we have others that perhaps are a little bit questionable, as I'm sure happens in other parts of the world. It's an issue that's been raised on the floor of Parliament many, many times. And as a result of this wake-up call with the Demographic Health Survey, there's been lots of focused action occurring. The government has begun to act by the Minister ordering a task force on maternal mortality to get a report done. The report has been completed, and eventually the published report came out in 2009 with 8 major recommendations, basically to get back to basics, and it's deal with systems as we deal with the problems as well. The Maternal Health Command Post has been established at national level just with our response to HIV, which many of you know reached epidemic stage, generalised epidemic in Papua New Guinea, but it appears to be levelling off, but we must never drop our guard. Just as we have the National AIDS Council, we'll be establishing a National Health Command Post on maternal mortality, a very small unit to actually watch it from national level. Government and development partners are working very well together in the responses, and of course with health services in Papua New Guinea. Although we say government, the reality is that about 50% of the services are provided by the Church Health Network, which works with government in partnership to service the people of Papua New Guinea, and it is the preferred health network for most people. And so it's far better government puts money into that network because it is the preferred network. We have some best practices to do with maternal and child mortality. We have the kangaroo mother care concept for our preemie babies. We've got work happening with community conversations, which was introduced for HIV specifically, but it should be looked at to look at all of the underlying driving forces for any major medical or social issue. Because we have to attack the underlying driving forces as well as the issue itself. And that's where health must be everybody's business. I'm not the Minister for Health, I've got no professional health background, but I must make it my business because I'm the Minister for Community Development. The Education Minister, of course, must make it his business. So our big focus is we must strengthen our systems. They have become very, very poor. You know that we know, and many of you would know, because if you're here, some of you are here, I can see by the bill and bags that you have a relationship with Papua New Guinea. Many of our health service networks in the remote areas are now closed. We've got to get them opened again, and we must focus on this. So we've got to strengthen the systems, the healthcare systems, including the workforce and the facilities, and all the other systems that support it. So there are suitable roads and services to get those women to emergency obstetric care when they need it. And so that women can get to antenatal clinics. But if you have to walk 2 days to an antenatal clinic, you're not going to go very often to an antenatal clinic. So obviously we've got to take the services to the people, so we must up and strengthen our human capacity. And our midwifery training has been put as a number one, a very high priority in the whole area of strengthening the systems. With this, we must also strengthen the community-based responses. In Papua New Guinea, there's a huge disconnect between Waigani, the capital, and what's happening there, and the community. And we've got to really make sure we can reconnect communities with Waigani in the way we work. The Health Minister, in publishing this report, and just about 2 months ago, was the task force lock-up with the action plan. But he said to me, he said to a group of us, I'm sitting here with my fingers crossed. I know we don't have the capacity to implement this brilliant work that's a result of a collaboration between church, government, development partners, NGOs to produce this report. And so another initiative is happening, which really was the catalyst for it came from Australia, when the Australia Safe Motherhood Initiative CEO Dimity came up to visit us in PNG, and at the same time Mary from the Australian Reproductive Health Alliance came up to see us, and so I organised a very quick last-minute forum at Parliament. And so we're now working towards establishment of a PNG Alliance for Safe Motherhood, which will, of course, align with the Australian and with the global movement. And it's so important that everyone sees it as their business and not say it's the health department business. That the partnerships must integrate, not have parallel partnerships as we try to tackle this massive problem that is facing women in Papua New Guinea. Yourselves here, you're coming here as very concerned citizens, active citizens. What can you do? What can you do to help the women in Papua New Guinea and help stop the deaths of women in Papua New Guinea during childbirth? Talk about it. Talk about your local member. Encourage them to keep up. Encourage for the funding from AusAid to keep coming to PNG in these very targeted areas. Join Safe Motherhood Alliances and get involved by spreading the word that there is an emergency that must be addressed. And the key messages because I know we're just supposed to introduce now. We must remember that every mother matters. Sometimes in Papua New Guinea, you become very fatalistic about your health. Sometimes you're not very proactive because you just feel it's all beyond you, and people tend to be fatalistic and just accept that women will die in childbirth more than they should. So we must get the message out very clearly that every mother matters, and we must cut down on the number of maternal mortality, the maternal mortality rate. We must say it is not just women's business. It is everybody's business, and we must have community ownership. That's why in November 22, we will be having a larger Safe Motherhood Alliance forum during the budget session of Parliament to try to get the parliamentarians to see, well, how can I contribute to this? What can I do in my constituency, in my electorate out there in the back of the mountains where that man came out with his wife on his back in a bilum? And we must get back to basics. We've got to get the systems moving again, and that's where we have to do it. And I'll end by a quote from one of the former CEOs of Call to Action. How will the future judge us if we do not respond when we know that we have the tools available to do so? Thank you.